Good evening, Boston. My name is Michael Dillhyon. I'm the CEO, founder of Switzerland's Health Bank. I traveled 5,000 miles to come in and not talk so close to the microphone. I was going to say I just drove in from Zurich, Switzerland, and I came in because I wanted to talk about health, so it seemed like a good conference to talk about that. I specifically want to talk about health data and what's the problem with health data and how do we solve this thing called why don't we really care about our health? So unless you're really, really sick, you don't care about your health because essentially it's just too hard. It's too difficult to find out about what's going on with yourself. It's too difficult for providers to find out what's going on about themselves. We have here in the United States approximately $300 billion in inefficiencies in services delivered. Precision medicine is, well, imprecise. And this delivery method is really, mystery is quite expensive. So I bet everybody in the room's already covered that base many times. But I think this is the thought process that led about 180 of us to get together and say, how can we solve it? And we looked at the first thing we looked at was information flow and how information flows, and basically it doesn't. We wanted to attack it from the citizen perspective. Notice I don't say patient. Providers are notorious for not really providing information to the physician. And then we have Nerd-centric. I'm a reformed serial tech entrepreneur. So technology does not solve everything, and now we have 17,000 health apps, each with their own data, bit of data, information and a knowledge base, and no way to bring that together. Standardization, again, as a reformed tech entrepreneur, it's going to suck. Sorry, I can't think of anything more eloquent to say than that. We have a lot of disparities to deal with, everything from the way that codes are done and time lapse and all the things that everybody in the audience knows about. Open health, it's a great discussion topic. The only problem is, HIE, AOU, institutional bits, they're still not talking to each other. There's not a common goal to move forward to. And at the end of the day, the realization is you are the product. I think the Financial Times just reported recently that 20 of the top health apps deliver information to 70 different marketing sources. And if you're really sick, pharma loves you. You're a gold mine. So how do we solve this? I suggest we have an intermediary. Dillhyon, the guy that founded Visa, I better talk faster, came up with this idea of chaos, control, and order. I want to correlate that to trust. Openness begets transparency, begets diversity of ideas, begets openness. So we have to have a platform that has trust built into it. Here's a new idea. Guess what? The reason why this glass ceiling of 200,000 users seems to be haunting every single open data platform out there, if you're lucky, it's because we're not applying the same traction, thought, and marketing that we do in the tech world. I'd like to see that changed. Cooperation, notice I don't say collaboration, cooperation, that's the emerging social lubricant that we all need to be aware of, and that's what's going to make this happen. And how? It's a bird, it's a plane, it's a Genossenschaft. Genossenschaft is a very Swiss entity. It's not public sector, it's not private, it's not government, it's citizen-owned. 10 of the top, they make up 16% of Switzerland's GDP. 10 of the top companies in Switzerland are Genossenschafts. They're user-owned, self-governed entities. So again, there's no bias. You can't have bias. It's an individual, owns one share, and that's that. Funding back to the crowd. So it's my data. I mean, pardon me if we have any Apple or Facebook folks in here, but why should we be giving the money back to them? It should come to me. And there should be a platform that provides some transactional method for that. We need to shorten the information supply chain. It's, again, by providing a transactional platform, not a place where we concentrate on storage, but where we concentrate on the data flowing between the different pieces of the health ecosystem. Again, I'm Michael Dillhyon. I'm the CEO and founder of Health Bank. There's a whole bunch of us thinking about this. I'd love to talk to you after. I'll be here Thursday and Friday. We want to collaborate with everyone. We think it's a win for payers, providers, patients, citizens, pharma, industry. There's an opportunity here, and thanks for letting me talk about it. Cheers.